Good morning, everyone. Adrian Charkundi, Volker Vessels UK. So I'm Corporate Responsibility Director. So I was just distracted by something coming off our roof, I think, in our office. But yeah, amongst other things, I'm responsible for our occupational health team. So with Eileen today, looking forward to talking to you about peer support networks.
Fantastic, thank you. So as you will have heard probably then, this session is being recorded and it will be up on the school website, so you can watch it again, share it, whatever you see fit. But just so you know that this is being recorded. As was said in the chat function, you've actually got the opportunity to ask questions. We're really going to try and make this as interactive as possible after we've shared some insight with you, because I think this topic quite often creates questions and discussion. So we want to make sure that we leave plenty of time for that. So do put your questions in the Q&A, and we will get to those after we've just both given a little bit of insight into how to improve your peer-to-peer support network. So I'm going to share my slides with you and just rattle through a few slides and share some evidence of what does work and what doesn't work. Okay, so some research that Ripple and Co did last year, 6 months worth of research, and we were doing this as part of a product development process, and I'll talk a teeny bit about that later on. But what we were trying to find out is what are the challenges for, and I will cut to mental health first aiders or first aiders, just so we can be quicker in our language. So what are the challenges? What are the barriers to them being effective? And I guess what we were finding out is that it really starts right from the word go, when people think about putting a network in place, and that actually it is about sometimes not having the right people in that role. So what we end up getting is sometimes this idea of a lack of boundaries. So we may have informed, but they are still unskilled volunteers who quite often, because of their desire to help and save, a word that they use, they overstep the role and they take on a counselling role, which quite frankly, after 2 days of training, they are not qualified to do. There is an elevated risk that comes with that, of course, and really it's that inappropriate intervention that the first aiders fulfill, because they're fueled by that hero mentality. And really what that is doing is elevating the risk to them, it's elevating the risk to the colleague they're trying to support, but it is actually elevating the risk to you as an employer, because ultimately these are acting on behalf of the company in partly fulfilling the duty of care to that employee. So there is an element of certainly a question around the liability if that colleague, if that first aider is inappropriately intervening with a colleague. Of course, there's a veil of confidentiality around our first aiders, and in essence, if we could somehow protect that confidentiality but still get insight of what's happening on the ground through the eyes of the first aider, imagine the value of that insight for further action, for further investment in wellbeing, and really tackling the hotspots and the vulnerabilities of common wellbeing and mental health issues. Now, of course, this role is very time intensive, and we did find that in our research, and that unfortunately does two things. It detracts from the first aider's core job in some instances, but it also is impacting their time in looking after their own well-being, and I'll give you some stats on that in a minute. So of course, without that insight into what's happening in the business in terms of the well-being and mental health, potentially your business is making ill-informed decisions, unintentionally, of course. But I have seen this with other managing directors who put in place what they think is needed, but without that insight, they're not really sure that they're tackling the root causes of poor mental health and well-being. What we also found in our research is that in order for first aiders to be effective in role, they need to make notes so they can remember who they spoke to, when, and what they spoke about. Now, for some, that does go to informal tracking systems that they employ themselves. It might be the back of a notebook, it might be their phone, it might be a spreadsheet. So clearly what we have there is a potential breach in GDPR. So we have some potential legal issues there. We also know that there is an increased need to be able to demonstrate your duty of care. In some cases, I think we can probably expect an increase in need for reporting and need for evidence around that duty of care to be able to demonstrate best practice and that we've been fulfilling duty of care to those most vulnerable employees. And that's certainly what I'm hearing from HSE, that they are now really, well, as someone, a senior psychologist, said to me, it's round the corner. The prosecution of someone for not upholding their duty of care in terms of protecting psychological safety, they expect those in-court prosecutions to literally be round the corner. And as we well know, statistics even pre-pandemic were telling us that it is an increasing cost to business, both in terms of the services they're trying to provide to manage it, but also the knock-on impact it's having on engagement and also productivity. So let me share with you some of the specific data that has actually come out of the research that we did. So if you wanted to access the full report, by the way, there is a link there. You'll be able to access the full report of not just my research, but actually some research that the Wellcome Trust did as well. And that Wellcome Trust research came out in May 21, so just before we released our results of our survey. And whilst they said, yes, peer support is good, it does work, actually there are what they call significant concerns when it comes to the implementation. And those main concerns were very much around the visibility of what the first aiders are doing, the supervision of those first aiders, and then also the potential gain of the insights if they were able to see what was going on. So we know that those who volunteer for this role have their own experience of mental ill health, which actually makes them very effective in this role, but does make them very vulnerable at the same time. We also, as I said, know that they don't have time for their own well-being. So obviously that is, this idea of you put your own oxygen mask on first, that's not what they're doing. And then unfortunately, a lot of people were saying it has had a negative impact. And for one company, that was as high as 54%, which is obviously a lack of duty of care to that first aider themselves. And you've then got to ask yourself the question, if that's how they're being impacted, how are they then able to support someone else? 77% on average would access more support if it were offered. And of course, that support can come in lots of different ways, but they wanted more support, whether immediate support afterwards, support for finding the resources to signpost people, or just generally support with their well-being and continual development in this role. Now, perhaps one of the most alarming elements of this is the fact that the first aiders are debriefing to friends and to families. Now, for one company, that was 77%. Now, we know that trained therapists who trained for 7 years have clinical supervision all the way through their career. But that's not happening for first aiders, and yet they are still being exposed to emotionally sensitive and sometimes triggering content. And after only 2 days training, for me, I think our responsibility does lie in giving them an opportunity to debrief, to offload, and then emotionally detach. If they're taking it home and they're offloading to a family member who is not trained in clinical supervision, then I would suggest that that emotional attachment to the content is still there, which is rather alarming. And then 61% said they've had to spend time seeking more information to be able to assist a colleague. So again, that's more time out of their role. So there's lots of things here that in implementation needs to be addressed. And certainly the key features of effective implementation really do start from the recruitment and selection. Have you got the right people in role, or is it just people who said, yeah, I would love to do it? Do they have the line manager approval? Because if you get that line manager approval, then you know that they have the capability and the capacity, but you also know that line manager is going to give them time to do it. Then who's training them? Have you got the right trainers? How long have they been trained for? Ideally, maybe it's an accredited program, maybe it's an actual level 3 accreditation. And perhaps there needs to be a code of practice which really stipulates what the boundaries are, the expectations, and the requirement of them to signpost on and not counsel themselves. And of course, as you can see from these statistics, the importance of emotional detachment and that support in this role. And then hopefully CPD in this role to look after themselves, to look after the people they're supporting, but also refresher training. And again, the question, when are you doing it? Who's doing it? And what should that involve? So if you've not done refresher training and included any of the impacts of COVID, then their information about mental health right now is probably quite out of date. Now, even if you do all of that, and even if we see a change in these metrics, this has to be part of a comprehensive and an integrated approach to wellbeing, because quite frankly, peer support is not a silver bullet. So what can we do to help these first aiders in the first instance? Well, as I said, the research I did was really about a product that I'm hoping to develop. And this is the only sales pitch in the presentation. But this is the tool that I intend to develop. So it's in development at the moment through stakeholder engagement. And what we want to do is we want to track what the first aid is doing in an anonymous way to protect that confidentiality, so that they have almost their little green box, their physical first aid kit. This is their first aid kit where they track, they have lots of resources, they know where to signpost, and they're tracking what is going on in that conversation. But all of that aggregated and anonymous data will then be management information for you to see what your first aiders are doing, but also to get that insight into what are the commonalities of mental ill health and poor wellbeing in your workplace, so you can start to make informed decisions. And then that's such critical supervision, which wouldn't be called clinical supervision, because I think, again, it kind of elevates their status, but instead reflective practice. So they're being supported on a regular basis by a clinical professional. And then, because this is a snapshot of what the wellbeing is within an organisation, my intention is to take an evidence-informed questionnaire that was actually developed and tested for DWP and then MOD, and a really comprehensive questionnaire, so we can see what's going on across the entire organisation, and then potentially precipitate pulse surveys out of that on the most vulnerable wellbeing metrics in your organisation. So very much this needs to be an integrated approach, as I said. So that would look like this, for example. We would have not just a peer support, but we would put all the support mechanisms around it. But that in itself also needs to be integrated into a much more holistic strategy. Because what we do know is that there are 5 key drivers to wellbeing in the workplace. And so all of these ideally are addressed in order for a wellbeing programme to be as effective as possible. So it's health, physical, mental and emotional, the security, whether that's either high risk jobs, physical security, but also financial security as well, and job security. Purpose, are people aligned? Do they feel that they belong to and support the values and the purpose of the organisation? Relationships, in particular, their relationship with management, which is 86% of a person's job satisfaction. And then the environment, whether that is the physical environment, or perhaps more importantly, when we're talking about peer support networks, the cultural environment. Is it a supportive and an open and inclusive culture that these people belong to? So unfortunately, we do know that over 4 in 5 employees agree that they would recover more quickly from a physical or a mental health condition if they felt supported at work. And I say unfortunately because a survey by Gallup in just 2020 said that actually less than half of employees would strongly believe that their business is looking after their interests. So people are not feeling supported at work. So this integrated approach with peer support network within that is really important. So in terms of those 5 drivers, what might that look like? So just very briefly, it is that open and supportive culture. It's wellbeing resources that people can tap into themselves, that are regular. It's not a campaign. Mental health isn't a one-day issue or a week issue. It's a year-round issue. Policies and processes, do they support a culture of well-being? And then support services that they can access as well. And of course, leadership. I talked about the importance of line managers. The leadership really need to buy into this. Now, the business case is solid, and if anybody needs any help on the business case for wellbeing, I can absolutely provide that from a business perspective, and also from a creativity, innovation, and really the moral imperative around it. But they need to role model it as well. And that's simple things like the expectation of emails outside of work time, they also need to cascade some element of empowerment to line managers. So line managers have an autonomy to make on-the-spot decisions to support the well-being of their employees. So lots and lots to consider. There's quite a lot to do there, and some of that perhaps feels a little negative. So just before I hand on to Adrian, I want to give you the upside to peer support, because it is absolutely a positive thing to do in an organisation. So this has very much come out of the Wellcome Trust research I mentioned, that it does have a positive impact on mental health, and it does decrease the symptoms associated particularly with stress and burnout. It can have significant enhancements in well-being, and interestingly, particularly for the person who's doing it, who's actually the first aider, generally will promote employee and organisational resilience, and can reduce the symptoms of depression, anxiety, and exhaustion as well. So it really is a good thing to do. But I would say it just needs to be done really, really well. Otherwise, I think the unintended consequences sometimes actually can be more significant than not putting it in there in the first place. But it's not that difficult to do, and it's not that difficult to tweak to improve. So I'm going to hand over to Adrian, who's going to give you some of his insights from implementing peer support networks.
Thanks, Eileen. Just bear with me a second whilst I just share my screen. Has that gone into
It has. You're all good.
full screen mode? Good stuff. Okay, so good morning, everyone, again. Thank you, Eileen. So just going to talk through some of those elements again in some detail. And this is based upon my own experience of having a network within our organisation. We've had an internal occupational health service for coming up to 15 years now. And we've had a network of what we call mental health champions, who are 2-day MFHA trained. We've had those in place for maybe 3-4 years now. So this session this morning, I'm really going to talk from experience. So it's important that when we look at the role of the MHC, the mental health champion, that we do recognise and maintain the boundaries. It's important that you stress that from the outset. You know, the champions are there to signpost. They're there to be additional eyes and ears for your business, to look out for their colleagues and be a point of contact. You know, they're looking for somebody who is displaying behaviours that aren't the norm. So it's the individual who's normally loud, being quiet, and conversely, somebody who's normally quiet, you know, being quite open and perhaps even extroverted. And that's what the champion is there to do. But it's important that it is stressed to champions that they're not there, as Eileen said, you know, they're not counsellors, they're not therapists. And that's one of the challenges around having this network in place, is that sometimes champions can overstep their role, but genuinely for the right reasons. As Eileen said on our last slide, you know, having this network is immensely beneficial, and even just having the network within your business can boost the culture. You know, it can, your employees take a lot of reassurance from knowing that network of champions are there should they ever need to call on it. And this is part of, you know, a wider service offering, you know, to employees, in addition to things like, you know, healthcare, employee assistance programs. It might be access to other services such as an occupational health team. So it's part of that bigger picture. The pros and cons of being a champion, however, you know, when you look at mental health champions, you know, they do it because they often want to, you know, give help to their colleagues, but based upon some form of personal experience. So generally, those that volunteer for these roles already have this ability to empathise with people and understand. There might be some element of common ground of shared experience. And it may be something that they have experienced, or a friend or a close family member. It therefore sometimes becomes difficult for them to step back. particularly when you're working with someone on a regular basis, so from the same, same site, same office, same area, same team, might even be the case. And sometimes that's difficult to step back and become, and not become emotionally involved with the issues. It's also important when putting these networks into place that you do remind people that they are acting as an officer of the company. And whilst it leads to some difficult conversations around boundaries on occasion, you have to remind them of this very important fact that they are providing support to somebody, some signposting, but they're still doing it as an officer of your organisation. Because the challenge is also that when champions might overstep the mark, they might end up sustaining long-standing support to individuals. It can go wrong with these networks, and it's important that we share these experiences, because it's something you do need to be aware of if you've got a network in place already, or it's something you're considering, because then it enables you to be forewarned and forearmed for these scenarios. So, I've seen situations where an individual may rely quite heavily on the champion, as they don't want to use the signposted services. And it might even be the case that that individual engages several people to support them. So the champion and the colleagues become the support network, not a professional. And that may be because, as I said, they've decided they don't want to use the signposted services, or actually, particularly this is a concern at the moment, that they might be engaged in a support service. There might even be, there might be a diagnosed condition, they might be already engaged with a crisis team, or they might simply be engaged with a counsellor. But sometimes, for various reasons, those don't work. So often, counselling is very personal. The relationship between the individual and the counsellor has to be correct. So sometimes, actually, it's a case of changing the counsellor. And then the relationship improves and the counselling becomes more effective. But sometimes the individual may be part of some professional support network and it's not working. So everyone then becomes emotionally involved, and that really can place a significant strain on individuals, particularly when there's several people involved, but more worryingly, if it's just the one individual. It then, as Eileen said, in terms of the offloading, it's not very healthy for the champion, and the individual themselves isn't getting the professional help that they require, and they're not getting access to it as quickly as possible. And there is always this risk that even with the best of intentions, that the champion may give the wrong advice or give insufficient advice to somebody who needs help. And it's important to take stock of the fact that the NHS mental health service, very good. It was under strain in advance of the pandemic. It's even more under strain in the current market, in the current environment, because we've seen the number of calls to EAP services increase, the number of people seeking help from the mental health service in the NHS has increased as we've come out of some of these lockdowns, and therefore the route to support services is going to be much slower. So it's important to also understand these challenges. There is another unfortunate point to make. It's not something that I do so easily, but sometimes there is a reality that some individuals will actually state they have a mental health problem when in fact they don't. They're using it as a means to achieve an end, and it may be other matters. It may be performance of the role and happiness, disagreement, etc. It may be something that is more around, line management than something that is a mental health issue or something that should go to counselling or occupational health. And I have seen it where mental health champions have been dragged unwittingly into these situations, and then suddenly find themselves in the middle of a disciplinary issue or even employment tribunal. But it's important that champions and those overseeing these networks aren't suspicious to every individual, because it will fail if that's the way you approach it. But you have to be conscious of these signs or signals, because there is this unfortunate reality that sometimes the minority of individuals will abuse the system, and they will drag a champion into a situation if there is something going on. It does happen, unfortunately. When talking about the role of the champion in terms of maintaining good networks and again reminding people about the boundaries, you could consider a three-step approach to the way the champions approach the way they operate. So there's the initial conversation, whether proactive from the champion or from the individual, and that's where there's discussion on what the issue is, and that's the initial signposting by the champion. The second step would then be a follow-up by the champion to ask the person if they received the help they needed, and also whether it was effective. And if they've decided not to follow up on that signposting and seek the help, then ask the question why. But there really shouldn't be any further than a third and final follow-up by the champion. It may be a very similar conversation to the second, but it's really then determining why and if they have received the right help. It might be they need re-signposting to a different service, but any more than 3 conversations, the champion really does run the risk of becoming part of that individual support network, and the individual will start to rely on the champion too much. And it's important that the champion has to remain emotionally detached from the issue as much as possible, which I appreciate as a champion myself, as well as having oversight of the service. I appreciate is really, really not easy. There's definitely a skill to that comes with experience. So just coming back to key thing around the assessment process, because this helps with avoiding some of these pitfalls. So something that we introduced is a pre-assessment process. So first step is the champion has to volunteer to hold the role, and they're fully understanding of what the commitment is, what they're doing. Even if they're recommended by a colleague or line manager, they still have to volunteer. They've got to know what they're doing, go into it willingly. The line manager, supervisor, has got to consent to them volunteering for the role and ensure they've got sufficient time to act in the role of a champion. And that's also making sure they're being suitably proactive and not just reactive to all the issues. Selection should involve a direct conversation. We're fortunate that we have a direct occupational health team, but if it's an appointed person, there's a check with the line manager just to assess the individual, to determine whether they are the right person, whether they've got the right soft skills to act as a champion in the role. And sometimes the answer will be no. There might be certain concerns about the way the individual conveys themselves or engages that actually, again, coming back to that fact, they're an officer of the company, you can actually make a decision to not have them as a champion. And obviously you need to manage that conversation correctly. But from the outset, you've got to be very clear with the champion that what the boundaries are, and they're there to signpost and not there as counsellors or therapists. And this is really just summarising this around these stages. So we have the initial assessment, the conversations. I think I've got on the next slide some of the soft skills that we assess them against. But it's only then, once you've gone through that step, you then will look at their training. And again, as a starter, the 2-day mental health first aid course. But these are the skills that we would typically look for or assess an individual against, to ensure that they've got the right skill set to perform effectively in the role of an MHC. We are making these slides available afterwards, so don't worry about taking all this in just now. Key thing then, again, as Eileen said, about how you monitor their activity. You can quite easily put a network in place and actually then leave it to run and almost forget about it. Well, that's not the way to manage the network, and there is certainly some maturity that comes with the network and the service, and you will develop it with time. Somebody has to have oversight of the program. Somebody's got to be the leading responsible person to ensure that it's fulfilling the desired outcomes of why you've got it in the first place. you must, whatever the means that you determine is suitable for your business, you've got to maintain regular contact. That could be, regionally. If you work nationally like we do, gathering everyone together, we've got some in the region, about 200 champions. Getting them all together on a regular basis is not easy. And I would also recommend that these gatherings are face-to-face. Some things are done better face-to-face. And personally, I believe that any mental health training should be classroom-based, not online, because it's very personable. And these gatherings, ideally, I recommend they should be face-to-face as well. Something we looked at also was an annual gathering, seminar, whatever terminology, and get some external speakers in. And you can get people to talk for short periods of time, but anything from, resilience to mindfulness, effects of the pandemic, that's something that's certainly quite important. And you can generally, around your framework, seek support from external bodies, Mates in Mind as well, and then other organisations that you already may have contact with. Somebody posted in the Q&A about the Lighthouse Club. So there are a number of external organisations that are well versed in support networks that can offer some advice and also come in and speak on key topics. Refresher training is quite important. I personally would recommend every 3 years, but the content should be updated. We were talking about the impact of the pandemic. There's emerging research around the considerations of things like brain fog and people working at home too much. So it's important that these are brought back into the refresher training. It's an opportunity to make contact with your champions and update their thinking, their CPD in a formal way. Yes, there's some great tools out there that are off the shelf. But you can also, like we did previously, you can actually set up some very simple questionnaires as a precursor to something bigger to assess the effectiveness of your support network. So, for example, you can ask questions like these, and they're very effective in giving you a feel for whether or not the network's operating correctly. And, when we last ran this questionnaire, we had some very positive feedback. I was actually surprised, worried, and pleased all at the same time around the fact the mental health champions were having lots of engagement. But actually, I think of all those that we surveyed, and we had something like a 50% response rate out of 200 on the survey, which is good for any survey. And I think the only people, there were only 2 that didn't want to continue being a champion. One was because he was retiring, so we'll allow that one certainly. And then the other one was simply because of a changing role, and they felt that they wanted to step away from it. So again, if people want to step away from the role, then that's something you should actually listen to and follows people's wishes around those kind of decisions. But some very simple questions like this will allow you to build questionnaires as a stepping stone to something bigger, because it will identify, some of these will give you quantitative answers, some of them will give you qualitative answers. So you should use a mix of both, because then you get a feel for what the issues are and just how effective your champions are. And listen to them. Really do listen to your champions, your first aiders, because they will have a wealth of ideas that you may not be thinking about. So it's very important that you do, treat your network like a community. It's a great thing to have a peer support network. It really is. It benefits so many people. And, over the years, I've seen so many good examples of where effective support has had a huge impact for so many individuals within our business. It really is a very positive thing. I think that then leads me on to questions. So what I'm going to do is I'm going to stop sharing my screen, bring Eileen back into the fold, and she is, and then let's have a look on the Q&A. So I've just got one question up here at the moment. So I can see 48 participants. So if anyone does have any further questions, then please do post them on the Q&A, because we felt from the first session we ran around how to implement a network. We had lots of great questions around this subject. So please do post them up before we close. So the question here is, we're having problems getting the MHFA to join in a monthly team call, which has been set up as a support network and continued development refresher. Of the 22 in the group, there are a core about 6 who regularly attend. Any suggestions on how to improve attendance? Yeah, I've had similar challenges, and it comes back to doing the survey to assess how effective the network is being. But in the network maturing in its approach and looking at different ways to monitor information, I am actually of the opinion now that I think there needs to be some commitment. There needs to be a commitment from the champions to also engage. So if you are going down the route of using, monitoring tools like Plato, as Eileen described, then there's got to be a commitment that, okay, if you're taking on the role of a champion, we're training you to be the champion, then actually you've got to engage. You've got to participate in any events, any refreshers, or any tools or techniques that we actually arm you with. And actually, if people simply refuse to engage or don't engage at all with repeated attempts, then I consider actually, removing them from the network. Because if you've got no means of communicating with them, you don't know whether their role is being effective, you don't know whether they're active, you've got no feel, particularly if you're a geographically dispersed business, you've got no feel for what's going on unless you're close to exactly what's going on in that location. There is a danger that if that person doesn't engage, you don't know what's going on. So I think you're well within the right to remove individuals, from your cohort of champions if that engagement is there. There's got to be a clear commitment. That's something that we're refreshing as part of our program, is just making sure that people are engaging. So I think actually when I ran the survey, we didn't have 200 champions, we had about 140. So I think, it's about half of that responded. But you need to be considerate of people not engaging. Have they just stopped being a champion? Are they no longer interested? But do feel free, in my opinion, to remove them because there is a concern. Eileen, have you got anything to add to that?
Yeah, it's just a little bit. I think you're voicing a challenge that, in my experience, an awful lot of companies have. That most of the companies that I've spoken to and the research that we did, the engagement with their first aiders is really, really difficult. And I am of the same mind as Adrian, that there is an expectation on these volunteers as a result of them taking on this role and as a result of you investing in them and training them. I appreciate that they're volunteers, and I think that kind of brings a sense of, we can't make them do anything because they've volunteered for this role. I spent 20 years in the corporate sector, and I often had volunteers who kind of supported me in the role that I did. I worked in sustainability, and I'd have champions, environment champions, social champions, charity champions. And there's two sides to that question, in the respect that you need them to engage so you can keep them updated and you know what they're doing. And then secondly, if they're not doing it, you need to know that you need to replace them. So if they're not engaging with you and you've potentially got a dispersed organization, you might have areas of your business that are not covered by first aiders. And of course, you need to know that, because that makes that particular area then vulnerable. So I do agree with Adrian that I feel that they are, to some extent, they are a champion and a volunteer partly upholding your duty of care to your employees. And for that reason, there are particular criteria when they take on that role. I mean, one of the things that I advocate, as well as how you recruit your volunteers, also how they have to sign up to a code of practice, because it protects them, it protects your liability, and it protects those they're supporting. So it's a hard message, but I do think if they're not willing to engage, there may be reasons for that. And you need to know what they are so that you can then re-recruit, retrain, and know that you've got an effective and comprehensive peer support across the entire organisation. The other thing, of course, is that, are those regular engagements valuable to them? So I'm making no assumptions here, Tina, but when they come to those engagement points with you, what do they get? It's something that I'm constantly thinking about with Plato. Plato is not a management information tool. It's a support tool to help the first aiders be as effective as possible. If they don't use it, it doesn't really fulfill its remit. So ideally your engagement with your champions needs to be really valuable to them. And what I've found in my research is that mental health first aiders want to belong to a community of first aiders. They want to feel like they themselves are peer supporting each other, one another. So is there a way of ensuring that this isn't just a push of management information to them? I'm not suggesting it is, but actually it's a very valuable time for them to come together and share and learn and network with their peers. But I absolutely agree with you. This is an in common challenge across many organisations.
Thanks, Ali. I've got one more question that's come up actually. How can SMEs implement an effective mental health champion program with limited resources? I actually think that's reasonably straightforward. You just do it on a smaller scale. Start small. We started within our business with a relatively small number of mental health champions, and that's then grown over the years as the program has developed and we've tweaked it. The first step, as they say, is often the hardest, but you can actually still put something in place with a small number of champions and test the water as to how that works, within your business, because it's got to be aligned to how you operate, how you're structured, how you're spread, and it doesn't have to be complicated. As I said earlier, it's part of a wider package of support to employees. It's important also to recognise that people will choose different routes according to who they are. So we don't rely on one stream. So we don't just rely on the champions. We have employee assistance program. We have private healthcare. We have occupational health. Obviously, as I said, we're quite fortunate in that respect. And people will use different routes according to who they are. Some are happy to pick up a phone and talk to the EAP service. Others aren't. Others would rather talk to a champion. So you've really got to make a start, find your way, and adjust it. If something's not working, fail quickly. Don't try and pursue something and make it work if it's not working. Really just make a start and then progress it and develop it along the way.
Yeah, I agree with all of that. It is about doing it smaller scale and starting small and I mean, the great thing about well-being and peer support networks is that actually you should, if you're able to, you should be able to see a return on that investment. And I wonder whether if you pilot it, start small and pilot it, you start to see the results, you start to see that return on investment, depending on how you measure it, absenteeism, productivity, etc. That may well then give you the business case and the financial case to do more. It will take time, and it is very difficult to measure efficacy of a peer support network. It's one of the things that I'm grappling with at the moment with Plato. How do you prove that having them actually is effective? Well, thankfully the Wellcome Trust has gone part way to that for us. There are measures. You've got your standard ones, your absenteeism, but then you do have your subjective measures as well, which hopefully you're able to put into either pulse surveys or engagement surveys, or even a specific wellbeing survey. And even just monitoring how often they are having these conversations will give you an indication of how effective they're being, and hopefully that would then potentially release more budget to do more. I'm just going to pick up on Chloe's question. Are there any physical resources that as mental health champions we can hand out or use in meetings? If you consider, my view is the core element, well, there's kind of two. I think the absolute core for most businesses when it comes to peer support, the core responsibility is that conversation, that spotting the signs and reacting to a colleague who wants further support. I think if we can support them in having those really effective, empathetic conversations, then that is probably the best tool you can give to them. So yes, that could be training in conversational skills, but actually it could also be there are toolkits. And whilst Adrian answers this as well, I will have a quick Google search, because I'm trying to think whether it's HSE. I think it might be HSE. I'll have a look for it. It's a talking toolkit. So you could give them that. The other side to the role for me, because the return on investment of wellbeing interventions is way higher for preventative measures rather than reactive measures. And if we only see our first aiders as reactive, catching those who are beginning to fall or who have fallen, then I think we're potentially missing out on a whole side of what their role could be. This proactively creating that culture of well-being, cascading messages. So I would say other resources that you could signpost your champions to are the kind of resources that they can just pick up and then implement wherever they are in the business. Or maybe it's about them being created at central level and then being cascaded down. So you're almost using your champions as a communications channel. And there's loads of wellbeing resources on the website of all sorts of different websites. The 5 ways to wellbeing, you know, sleep, all the different wellbeing topics, stress management, etc. There's a proliferation of different resources. So you could access those, package them up so they work for you, and then cascade those down to your champions. But I'll hand that over to Adrian whilst I just do a quick Google on HSE.
This is where I could be very mischievous and actually make a very short answer to see how good Eileen's Googling skills are. But yeah, there's a lot of stuff out there actually. I guess with any topic, you might say that there's too much. Again, you've got to find what works for you. If we look at the way, for example, that we provide information to our employees around occupational health in general, we, for example, put together a booklet that was sent to every individual. We tag it on the back of any relevant communications as well, and that will summarise some of the main care lines that they can also access. So we actually make it available to every employee, not just the champions. The champions, however, might have regular supplies of the employee assistance program. Having an employee assistance program, one of the biggest challenges is actually reminding people that we have an employee assistance program. And it's making sure that you've got those prompts. Some of them will use cards, little credit card size cards as well that will have the information lines. But again, it's really about finding what works well for you, and it might be about having separate. If we look at our OH campaigns, for example, that we run, we found it particularly useful like this to run sessions where we've had a specialist come in and talk about a subject, and then you have half an hour of questions, and that's proving really effective to engage people on those sessions. Yes, it's an online environment, but actually you're getting people to come to topic specific stuff that is often relevant to them, and we're finding that just as effective as handing things out, because certainly in larger organizations, one of the biggest challenges you are going to have is around communication across any subject, and trying not to saturate the business, also not trying to turn it into a nanny state, also understanding what the boundaries are. It's not easy. So you've got to find what works for you without overloading both the individuals and the champions. But there's some great resources out there. But I'd stick with the main people. Stick with the regular familiar names. The Minds, the Mates in Minds, all those kind of organisations in the Samaritans. They've got tried and tested support and guidance.
I've just come across. I ran a webinar this week, and Bupa were one of the panelists, and actually they sent me a bunch of links. So I'll share those with you, or by all means go onto the Bupa website, and there are freely accessible resources on there too that you could use. I'll have a quick look for those. And also, can you see? I don't know if you can respond to this. Can you see the link that I put in the chat function? And that is the HSE Stress Talking Toolkit, which has been specifically developed for construction. So you've got that. I don't know how you can tell me whether you can see that. Can you see that?
I can.
I know you can. So I'll tell you what, just in case you can't, let me share my screen, because on there is the Stress Toolkit link. I've just put it on.
Yeah, so Jules has just said, yeah, they can see.
You can. All right, so I don't need to share that. Fab. So I tell you what, if there's there is another question in there, or is that where it says yes you can? Awesome, thank you for that. Let me just have another quick look for. I want to share with you what Bupa sent to me, because they're freely accessible resources. Let me see if I can signpost you to those as well. It's bupa.co.uk. Let me find the best one. Managing wellbeing, that looks like a pretty good one. Okay, I'm going to put that in the chat as well. But this is just, I mean, as Adrian says, absolutely get it from recognizable, credible sources. And just do know that there's an awful lot of stuff out there. I think sending that to your champions is a good way of getting the information there. I think just posting those and expecting the general employee workforce to access it generally doesn't happen. It's quite a passive way of pushing information to them, but hopefully certainly cascading through your champions will help.
Okay, I don't see any more questions on the Q&A. So I guess if there's no more questions, we can bring ourselves to a close early.
Yeah, sounds good. Fantastic. Well, thank you all very, very much. We've just posted a link to the feedback form, which it would be great if you could fill that in just before we finish. Thank you very much for your interactions, your questions. And as I said, it is being recorded, so hopefully you can access that or pass it on, share it around as you see fit. So thank you all very, very much.
Have a good day.
Bye-bye.